Good morning, and thank you everyone for joining us today, whatever time of the day it might be for you. My name is Jeannie Long, and I'm a director on the School Health and Nutrition team here in Washington, D.C. For the next 3 months, Save the Children is bringing you webinars focused on the best practices and lessons learned around menstrual health and menstrual hygiene management. I want to thank Child Sponsorship's Innovation Fund for supporting our team to be able to bring you these international MHM experiences. I'm really excited about our lineup. So here's a plug to please save the dates for our next webinars on November 12th for integrating MHM and gender transformative programming, and then December 4th for quality standards of menstrual hygiene products. Please note that today's presentations are recorded, so I kindly request everyone to keep themselves on mute during the presentations. Me and my colleague Laura will monitor the chat box and keep track of questions. So please, you can see if you can't see the chat icon, it's either at the top, if you scroll to the top over more options, or you might see it on the bottom with a little chat icon. We'll dedicate the last 20 minutes or so for questions for our presenters. So today we are talking about schools, and we know that they are a popular locus of menstrual hygiene and health programming. Although the linkages between addressing MHM in schools and school attendance have been globally emphasized, there's little rigorous evidence. We do know that supporting girls' self-efficacy, confidence, and reducing menstrual-related stress can have an impact on their school experience and performance. This webinar will present innovative approaches that integrate MHM into school-based programming and discuss what and how we should be measuring, to assess the impact of our work. First, we'll hear from the Zana Africa on the NIA project, which set out to understand whether access to sanitary pads and reproductive health education helps keep girls in school. And we will be hearing from Tatu Makaja and Beth Kangwana from Population Council. Then we will learn about the results of the menstrual health interventions and school attendance among Ugandans Meniscus 2 study from Kathy Kansime. I would like to introduce you to our 3 distinguished speakers. First, Tatu Makaja. Sorry, it's Majaka, it's spelled wrong in here. She has 15 years of experience in community mobilization, research and implementation, and capacity building, with a background in child rights programming, child protection, gender equality, and adolescent sexual reproductive health and rights. Tatu works with schools directly and with community partners to deliver sanitary pads and reproductive health education to thousands of adolescent boys and girls, as well as adults. She previously worked with Plan International to implement the NIA project, a seminal 2-year randomized control trial that evaluated the impact of sanitary pad distribution and reproductive health education in 140 primary schools. She has a Bachelor of Development Studies from Mount Kenya University and a Diploma in Community Development and Project Management from Kenya College of Commerce and Hospitality. Then we'll hear from Dr. Beth Kangwana. She's a Senior Program Officer at the Population Council, and she's an epidemiologist with 10 years of experience working in public health research. She holds a PhD in public health epidemiology and a master's in global health science from the University of Oxford. She's been working as a Senior Program Officer at the Population Council, Kenya's office, since 2018. She is a co-investigator of the NIA project, evaluating the impact of sanitary pads and reproductive health sessions on adolescent sexual reproductive health and educational outcomes. She is also a co-investigator on the Adolescent Girl Initiative, Kenya. She's evaluating the impact of multi-sectoral approaches to preventing early child marriage and childbearing in 2 marginalized settings in Kenya. And last but not least, Dr. Kathy Kansime. She's the study coordinator, project lead on the Meniscus 2 study. She works at the Medical Research Council, the Uganda Virus Research Initiative, and the London School of Tropical Hygiene and Medicine Uganda Research Unit. She has a bachelor's in social sciences, a master's degree in clinical epidemiology and biostatistics, and a PhD in public health, all from Makerere University, Uganda. She has 8 years of experience in research and 4 years as project management. She is passionate about adolescent health and working with young people for better health and education. So without further ado, I am going to start the presentation on the NIA project, which we pre-recorded for any worry that there might be problems with internet. So here we go. All right, we are on.
Next slide. Okay, the NIA project is the first study in sub-Saharan Africa to rigorously measure the independent and combined effects of disposable sanitary pads and sexual reproductive health rights education on girls' education and well-being. Next slide. Okay, the NIA project research was implemented by support of partners, Zana Africa, Plan International, Population Council, Kilifi County Government, National Government, and the funding organization Bill and Melinda Gates. Next slide. Okay, puberty is a highly vulnerable time for girls. During this time, girls experience emotional and social dynamics changes, biological changes, expectations to marry, limited access to menstruation products. Girls also lack knowledge on their bodies and their rights, predation from boys and older men, also lack of accurate, standardized, relevant, and engaging tools for comprehensive sexuality education, and limited evidence-based, no rigorous studies of proven solution. That was then, but currently we have some solutions through this project, that is implementation of reproductive health education sessions in schools and provision of the sanitary pads. Next session, next slide. Okay, during puberty, girls lack answers to their pressing questions. So through cue cards, girls were asked many questions. For example, what are the safe days to have sex without getting pregnant? When I get periods for the first time, what can I do? Among others. So these questions were collected from girls anonymously. Next slide. Okay, now the project had two components. So one component was facilitation of reproductive health education to the intervention schools and provision of menstruation health products. So the reproductive health education component, that was facilitation of the reproductive health sessions to the schools. That is the schools that had intervention. So these schools were taken through the curriculum, the NIA2 curriculum, which contains both information and skills to empower girls to make a right decision on issues of menstruation, menstruation and menstruation reproductive health that affect them. And the curriculum also was complemented by NIA teen magazines. The NIA teen magazines, they are coming in 5 issues. So this means every module was complemented by an issue. And the NIA teen were the extra material that students could read after the session and get most of their questions answered. And when these questions are not answered, maybe for some reason, there was a provision at the end of each magazine that girls still could ask questions. That page says, Ask Zawadi. Also, each magazine has a menstruation calendar. So this one also helped the girls to understand their bodies, so they could plan for their menstruation and prepare well. So it had all those components and it was easy for them to internalize the way it was done. Next slide. Okay, so the intervention, the project started in all the intervention schools from term 2 of 2017, and where the module was facilitated, that means every module was facilitated per term. And each module had several sessions, and the sessions were coming in different topics like getting started the values, understanding the setting goals, adolescence and puberty, gender stereotypes, among others. Next slide. Okay, now during the period that is after five terms, now we were able to deliver 3,072 near club sessions in the targeted schools, then provided 54,476 sanitary pads packets, that 10 packs was distributed to the girls, and also conducted 105 sensitization meetings targeting the community and stakeholders so that during these meetings they had an opportunity to understand the project, at the same time to ask any question that would have arisen from the project implementation. Next slide. Okay, the project was implemented by 3 key partners. One was Population Council. So Population Council was the researcher in this project. Then Zan Africa. Zan Africa was the overall program overseer. So they also had a role to develop program interventions and protocols, develop program monitoring tools to ensure the program was running well. And also with Plan, they were monitoring the sessions in the schools. Then Plan International directly implements field-based reproductive health education components through the mentors who are trained on the curriculum and had the content and the methodologies that were required. Then Plan also was doing monitoring to ensure the sessions were delivered as intended, that is quality sessions, and also conducting the sensitization meetings prior to the launch of the project in all the schools. Next slide. Okay, now this project was well innovated. Many people were involved. So like Zana Africa itself has that experience, 10 years plus, working with girls, working with women on the area of sexual reproductive health education, providing safe spaces, and also providing and also designing reproduction health management products. Then the materials that are used in this research are participatory. This means many people made a contribution. We had like professionals from the Ministry of Education, the Ministry of Health, and other interested parties also contributed to this, including the young adolescents themselves. So this content was delivered in an inclusive way through storytelling, activities, and comics through the lens of adolescent girls. So implementation was done through partnership, that's drawing on each other's strength. Next slide.
Okay, moving on to the evaluation, which was carried out by Population Council. The research question for the study was, what is the effect of sanitary pad distribution and reproductive health education on girls' health, well-being, and education, each on their own and also combined? So this was, next slide. This was a cluster randomized controlled trial. With guidance from the Kilifi County Government, Ministry of Education, 140 schools in 3 rural sub-counties, namely Ganze, Kaloleni, and Magarini, were selected equally and randomly assigned into one of the 4 study arms. So therefore, we had 35 schools in the control group, or the control arm, 35 schools in the sanitary pad distribution arm, 35 schools in the reproductive health arm, and 35 schools which had a combination of sanitary pad distribution and reproductive health education. Next slide, please. So this slide is just an overview of what the distribution of schools look like across the 3 sub-counties. The schools are represented as the green dots on the map, and we can see the different sub-counties. So we had 44 schools in Magarini, 50 schools in Kaloleni, and 46 schools in Ganze. Next slide, please. So as shown in this figure, the theory of change hypothesizes that sanitary pad distribution will increase the use of pads to manage menstruation, which will lead to an increase in two short-term indicators, which are shown in light pink. First, school attendance, and second, participation or engagement in class. So in the bottom line, the reproductive health education part of the intervention was hypothesized to lead to short-term improvements in girls' social and personal competencies, so namely sexual and reproductive health and rights knowledge and attitudes. And this included menstrual health knowledge and attitudes also, gender norms, and also self-efficacy. So the combination of the intervention was hypothesized to result in longer-term outcomes, which are shown in the dark pink boxes. And these include school retention, reduced unwanted sex, delayed pregnancy, and delayed first sex. So this study was powered to detect changes in the short-term indicators, which are the light pink boxes. Additional analysis will need to be carried out to determine the longer-term indicators, which is beyond the timelines of this study. Next slide, please. So the baseline survey was completed in May 2017, and soon after, in June 2017, the intervention started. The intervention went on for slightly over a year and ended in October 2018. Just before the end of the intervention, in June, we carried out qualitative analyses where we did focus group discussions and key informant interviews. We interviewed the girls, the parents, the teachers, and other key stakeholders to understand the impact of the intervention and how it can be improved. Then in December 2018, we carried out the endline survey. However, by that time, the girls had not yet transitioned into secondary school. They'd only just completed their primary school exams. So we had to come back in April 2019 to carry out a follow-up survey. And here we were able to get the girls' exam results for their end of primary school exams. And also we were able to find out whether they were able to successfully transition to secondary school. And then we're here now in September 2019, where we're now disseminating the preliminary findings. Next slide, please. The baseline survey was conducted between January and April 2017, as I've mentioned, across the 3 sub-counties. For the purposes of the research, a sample size calculation was carried out to ensure we were evaluating a sufficient number of girls to observe any real outcomes. So the target group was girls in class 7. So we conducted the girls survey with 3,489 girls. We also conducted a school quality survey based on the Ministry of Education, Science and Technology's Management Information System questionnaire. And this enabled us to collect data on school characteristics, including school infrastructure and also school performance. Next slide, please. So in terms of baseline key findings, when it came to schooling, we saw that girls had high educational aspirations. However, they did anticipate challenges in being able to transition onto secondary school and go on to higher education. And these challenges included poverty. Half of girls were also not living with both their parents, and they were also worried about school fees being a barrier to continuing education. There was also substantial parental approval for education, despite low levels of parental education. So parents also were encouraging girls to continue on to higher education. We saw a wide range of school quality. We saw half of schools had pads on hand for distribution. We saw large numbers of students per class, so around 46 students per class on average, and around 2/3 of girls had repeated a class. Next slide, please. In terms of school attendance, about 41% of girls reported missing school during the previous term. Of these 41%, 73% said they missed school because of illness, 11% reported missing school because of lack of school fees, and 3% because of menstruation. Other reasons for missing school included lack of food, water, and school uniforms. And for those who mentioned missing school because of menstruation, the reasons for this included lack of materials to manage their period and also experiencing pain from cramps or even headaches. Next slide, please. The findings in terms of menstruation and reproductive health, we saw that around 20% of girls reported having enough pads to manage their menses comfortably. Girls also shared feelings of shame and discomfort regarding their period and having insufficient levels of self-efficacy. And about 10% of girls reported being sexually active or have experienced some sexual activity, and half of those had reported that their first sex was unwanted. Next slide, please. So in conclusion, from the baseline, the findings describe a cohort of school-going girls with high educational aspirations, but a gap in their competencies to aid in completion of the educational goals. The NEAR project has the potential to bridge that gap, providing rigorous evidence to guide education and health policy in this area in Kenya and in the region. So the end-line results are in the process of being published and will be coming out soon. In terms of limitations and strengths of the study and the study design, one of the limitations is just not being able to have enough time to follow up the girls for long enough to assess the longer-term outcomes. However, the strengths are that it was a cluster randomized control trial, so there was we were able to limit a lot of bias in terms of the impact of other activities on the ground having an effect on the results we were seeing. And also we were able to add on the qualitative component onto the quantitative data to be able to understand the findings we were seeing. Next slide, please. So just to acknowledge all the people who were able to support us during this study. And next slide, please. Yeah, thank you. And just any questions and answers. Thank you very much.
All right, thank you very much. And we, please, if you have questions, I have a hard time seeing the chat box, but please put them in the chat box or write them down, and we'll make sure that we can ask our speakers more details about their projects after the next presentation. All right, Kathy, on to you about the Meniscus 2 study. Kathy, I see you, but I cannot hear you.
Okay. Yeah, the slide has just come on, thanks.
Can you talk a little bit louder or closer? Kathy, can you talk a little bit louder or closer to
the studies on menstrual health intervention. Menstrual health interventions and school attendance among Ugandans is our study. Next slide. Next slide, please. Yes, the government of Uganda has prioritized menstrual hygiene management in one of its policies, and there are a number of policies that have come into place. Meniscus 2 comes from Meniscus 1, which was to investigate menstrual management practices, barriers, and facilitators, and how these influence menstruation on school absenteeism. The first Meniscus 1 study was done in 4 secondary schools, and the key results that came out from the qualitative and quantitative was that we identified poverty and menstruation as barriers to school attendance, whereas the quantitative study identified that 35% of girls had stained their outerwear, 20% had missed school during their periods, and 77% reported stomach pain during periods. Then there were also psychosocial barriers and stigma that led to school absenteeism that was found in the study. We also assessed wash facilities, which were poor, and as a result to this, the Meniscus 2 was developed. Next slide, please. Next slide, please.
Kathy, do you see
Next
the
slide,
meniscus
please.
2?
No, I'm seeing the overview of meniscus 1.
Okay. I'm moving the slides.
Okay. So, presentation.
All right.
Next.
We can see it moving. It may just be the connection in Uganda is having a hard time seeing it move.
Okay, thank you. Yeah, Kathy, we're on the meniscus 2 study slide.
Okay. So meniscus 2, sorry. So the aim of meniscus 2, I'm not seeing the slide, but maybe I can continue presenting as you. Okay, was to review whether criteria for progression to a school randomized controlled trial would be met. And this was done by piloting the meniscus 2 intervention in 2 schools in Entebbe sub-district. So one of the objectives was to finalize and pilot the intervention package and also conduct a process evaluation of fidelity, sustainability, and acceptability of this intervention. So we also estimated the retention rate and effect size of intervention on school absenteeism. Next slide, please. Next slide, please.
Kathy, we can see it moving. It's just your connection. So if you can use your own deck, it has moved for the rest of the audience. We're looking at a study population slide.
Okay, yes. So we had a baseline survey that was conducted among 450 students in October 2017, and then also an endline study. By then, the students with 369 still in both schools, one government and one private school. So the age at baseline was between 14 to 19 for the private school, and then for the government school, it was around 13 to 21%. So the study was in Entebbe sub-district and comprised of 2 schools, a private and a government school. Next slide, please.
We're at the next slide. It says
Kathy, we're on the
intervention
next slide.
package.
Okay, so this presents the meniscus 2 intervention package that had 5 components. One was the puberty education, whereby 30 teachers from the 2 schools were trained on how to deliver puberty education, including gender-specific sessions. Then we had the second component as the drama skit. This one was between our implementing partner, Umena, who worked with the school drama clubs to come up with a drama skit to address psychosocial issues around menstruation and engage parents, boys, and teachers. And it was presented to the schools during the parent visits and the school drama times. Then the menstrual kit, also provided by our implementing partner Umena Uganda, included training of trainers and provision of the menstrual kit. The menstrual kit included a number of things: a reusable pad from AfriPads, and that was 1 pack given to each of the girls in the 2 schools, and inform tool. It included a bottle, a water bottle, included a small towel, and then also we had the pain relief package. This one included painkillers, paracetamol, and we used a voucher system to give to the girls. So for each voucher system, a girl would redeem 6 painkillers. And then we also try to improve the wash facilities by improving and installing locks, broken doors, and providing bins and toilet paper cages, as well as providing soap in water and water drums. Next slide, please. Next slide, please.
Kathy, we're on the next slide with just the pictures.
Yes, so these are just the pictures reflecting the 5 packages that we provided. For the puberty education, we used the Uganda National Menstrual Hygiene Management Training Manual. The first picture. The second picture is a drama skit rehearsal being practiced by the government school. And then the third slide, we see the girls demonstrating after the TOT training, they're demonstrating to their fellow girls on how to use the reusable pads, as well as training them on the menstrual cycle. Then below in blue is a picture of the voucher that we used. So each girl received that voucher to redeem 6 paracetamol tablets as shown in that table. And then the next picture shows the wash facilities that we improved. That is repairing locks, water drums, providing soap and toilet paper dispensers, as well as sanitary bins. Next slide, please.
We're on the
Next
method.
slide, please.
Kathy, we're on the study methods.
Okay, maybe I can just read through them, but I'm not seeing them reflected on my screen. Okay. So our main primary outcome was to assess school attendance. We selected 100 students from the 2 schools, 50 from each school, but by end line, we had 81 students out of 100 girls that were able to assess school attendance. And we were using the menstrual diary, which was given out to the girls every term, and they would fill this. It had a number of items. We wanted to assess whether the girls had attended school, half day, full day, or they didn't attend at all, or it was a holiday. We also wanted to assess if they had attended school that day, and then if they had had pain, or whether they were on their period. So this diary was collected over time for 9 months, and then we were able to assess. We'll look at the results later in the slides. Then we had a baseline survey of 232 girls and 188 girls at endline. So we're using questionnaires, using the tablets, and we wanted to assess the knowledge and attitudes towards menstruation. We wanted to assess the uptake and acceptability of the reusable pad and paracetamol, as well as wash, and then also the strength and difficult questionnaire that had 25 questionnaires was used, and this was filled by both by the girls alone. So the picture just shows the students trying to do the survey using the tablet in one of the government schools. Next slide, please. Next slide, please.
Kathy, we're still on the study methods. I promise I'm moving the slides along, so I think you might just want to read as you go. Tell me to switch the slides, but I promise you I'm moving them, and then you can just kind of read your slides.
Okay. So we also conducted qualitative interviews, and these were in-depth interviews with 20 girls, 10 teachers, 5 from each school, and 10 parents, 5 from each school. We also had participatory group discussions with boys and girls from the different schools. And then we also monitored the wash facilities, where the research assistants visited the schools 9 times over a period of 9 months, and they would just check to see that all the facilities are functional or not. Next slide, please. Next slide, please.
Kathy, we're on the knowledge of puberty and menstruation.
Yes, please. So we had on knowledge of puberty and menstruation, we collected the information both at baseline and endline, and we had 9 knowledge questions and wanted to assess how much knowledge the students had acquired over time. So generally, there was a substantial improvement in knowledge on puberty and menstruation, although on some of the issues like the menstrual cycle questions were not very well, the students were not knowledgeable enough. So for all the 9 questions, we wanted to know how many answered all of them correctly. We had an improvement from 11.6% at baseline, and then this improved to 23.9% for the girls at end line. And for the boys, the baseline was low at 4.1, but improved to 12.7 at end line. So we had questions that we asked on knowledge, excluding fertility questions, and there was also some increase in knowledge for both boys and girls. And then we had 4 questions that we were asking on myths, and these were Panados, sanitary pads, and whether a girl was clean during her period. And there was a substantial increase in knowledge for the girls from 16.8% to 41%. And then also for the boys from 10% to 24%. We had questions on the menstrual cycle, where we wanted to know what period blood was, how long the period lasts, and how many days are there between the period. So for the girls at baseline, there was 5.2%, and it increased to 29% at end line. While for boys, the knowledge was from 1.8% to 7.7%, which was a slight increase. Next slide, please. Next slide, please.
Kathy, we're on the baseline under 16 years and over 16 years.
Okay, thank you. So we also had a number of questions on perception of menstruation, which included self-confidence, teasing, and how comfortable the girls were during menstruation. So there was a slight increase for baseline from 12.2% to 31.4% for girls that were less than 16 years. And also, when we ask about those who had used manufactured menstrual materials at the last period, there was an increase from 74.8% to 90% for girls below 16. And for girls above 16, it was from 71% at baseline to 88.6% at end line, which was a consistent increase. And there were questions on leakage and whether they had stained their underwear. This we'll see them in detail in the next slide. We also wanted to know how many of the girls knew about effective pain management methods. So from baseline, we had 24%, which increased to 67%. And then for the girls above 16 years, baseline was 28%, and this increased to 73%. We also wanted to know of how many girls had reported pain at the last period. So it's also slightly increased. The number of girls who reported pain at last period was from 69% to 71% for girls less than 16 years. And those above 16 years, there was also an increase from 80% to, there was a decrease from 80% to 71% at end line. Next slide, please.
We're on the next slide.
So we wanted to, yes, we wanted to look at leakage, and we looked at this by type of school. So there was inconsistent reporting of leakage, and we thought that if we redo this study or in the future trial, we could try to rephrase the questions and improve this. So I won't go so much in details on the leakages. Next slide, please. Next slide, please.
We're on the drama skit performance.
Yes, the drama skit performance, we had an opportunity to ask parents through the qualitative study to briefly tell us about the drama skits, which presented all the 5 packages and was presented by the students to their parents. So from the quotations, we see that it was highly taken by the parents, and they mentioned that it helped them understand and be able to pick up information and initiate discussions with the girls. For example, a female parent, 37 years old, said, when we saw the skit, it gave us a starting point to initiate a discussion with our children, and even the men got the information. Next slide, please. Next slide, please.
We're on the pain management methods.
Oh, I don't see it on my screen.
Kathy, we're on the slide that has pain management methods during most recent period.
Okay, it has just come on, thank you. So there were, and apart from providing the painkillers, which were provided by the research team, the implementing partner, UMENA, provided trained girls on other effective pain management methods, such as drinking water, using water bottles, exercise, relaxing, eating foods with lots of water. And so 92% of the girls who had reported pain using and were using more than one effective methods at end line. So we see from the graph that those girls who reported to know more than 4 pain methods had increased from 26% at baseline to 71% at end line. Next slide, please. So we also wanted to know how many girls had pain at the last period, and these are reduced in the government schools from baseline of 73% to 69.6%, while in the private school, those who also reported to have had pain reduced from 76.5 to 75%. We also asked about those who had used more than one effective pain management method, and there was a substantial increase for both government and private schools. And we also asked whether the girls whether they had taken any kind of pain management, and we saw a reduction for girls in the government school from 23 to 6.4%. And also a reduction for those in the private school from 21.2 to 8.3%. We also wanted to know how many girls had used painkillers at the last period, since we had provided the painkillers during the intervention terms. So there was a decrease from 46 to an increase for 46 to 58% in the government school, and also an increase in the private school. So then there was also an improvement in girls who had used other effective methods from baseline to end line for both the government and the private school. So generally there was no change in proportion reporting pain, but there was improvement in pain management using other methods that they had been trained on. Next slide, please.
And Kathy, if you can, I want to make sure we wrap it up in the next minute so that we can leave time for questions and answers.
Okay, next slide, please. So this is just a picture showing the toilet facilities before we did observational visits. At the beginning, there were no bins in all of the schools, but later on we see an improvement in school 1, which is a private school, and then school 2, which is a government school, had a bit of challenges with the wash facilities. Next slide, please. So for the wash facilities, we also had the question. We wanted to see whether there was a change since the intervention package was provided. 86% of girls mentioned that there was a change, and 95% of these also mentioned that the change improved the way they managed their menstruation. Next slide, please. Next slide, please.
Kathy, we're on the outcome slide.
Okay, thank you. So our primary outcome was school attendance, and we wanted to see whether there was an increase in school attendance or not during the period days and non-period days. From our odds ratios, we see that there was a reduction in the association of odds ratios using from those girls who had missed school during the period days compared to those who missed school during non-period days, from 0.2, odds ratio of 2.12 to odds ratio of 1.26. Next slide, please. Next slide, please.
Kathy, we're on the next slide.
Yes, and we also had a question on, we had a question on stigma and anxiety, and there was a reduction in the number of girls who reported that boys teased them about their periods from 14% to 9%. And then there was also a reduction on the number of girls who said they felt anxious about the next period. And I think this is because they had been provided the reusable pad and improved wash facilities. Next slide, please. Next slide, please. Yes, that's just a highlight of the qualitative results. Maybe next slide, please. So one of the quotations was mentioning about, so we also had a number of challenges that we faced during the 9 months of the intervention. Most of them, sometimes it was low turnout of parents for information sharing. We had where school teachers were trained on puberty education and they were supposed to come up with work plans and deliver the puberty education to the students, which was not well achieved. And then other issues like overlapping commitments from the schools due to examinations, and we're not able to meet some of the girls to do follow-up studies with them. Then there was also follow-up of students who were sent home for school fees, and sometimes there was no communication from the school administration. Then the TOT participants raised issues on the available sizes of the knickers that were provided in the menstrual kit, which was improved by WOMENA. And then inconsistency in people were filling drums, cleaning toilets, and emptying the sanitary bins. And this was more common in the government school that shared facilities with the local, with the other community members around the school. And that was one of the problems that affected the wash facilities in that school. So we plan to engage more schools in ownership and sustainability of the intervention packages we provided. Next slide, please. So from our study conclusion and future plans, there was a substantial improvement in MHM following the introduction of the meniscus 2 intervention package. And that was basically knowledge and puberty, and also reduction of stigma and anxiety, the pain management, as well as wash, improvement in wash facilities. As we mentioned, that one of the objectives was to see whether we could pilot the intervention package and see if we can move to do a phase 3 trial. So currently there are plans for a cluster randomized trial in 48 schools to evaluate the impact of the meniscus 2 package in school attendance, performance, and outcomes. And this is planned to happen in 2 districts, but we are going to submit a proposal for this trial. Thank you.
Thank you, Kathy, for your
Next
acknowledgement.
slide is just different people we've worked with on this project.
Thank you, Kathy. So we only have about 7 minutes for questions and answers. I apologize, but I don't see anything in the chat box. So I'm going to throw a question out to the presenters for both of you to get us started. So my first question is, I realize that because these are both randomized control trials, you both in the NIA project and Meniscus 2, you collected a lot of data. And for practitioners who are working in MHM, who are monitoring their school projects and want to know, is this working? What would you suggest, were the most important indicators, or whether they're monitoring or results level indicators that you would suggest country programs put into their monitoring and evaluation? Maybe I'll start with Beth.
Okay, thank you. Just in response to your question, I think I would go back to our theory of change, and I'll just mention in terms of the evaluation, if you are including a component of reproductive health education, then obviously monitoring increased knowledge and also improved norms and attitudes, and other psychosocial outcomes such as self-efficacy would be useful. And in terms of the sanitary pads provision for the evaluation, if you are interested in looking at the impact of it on school attendance and participation, then those outcomes would be very useful. But we also found the asking girls whether they had sufficient sanitary pads to manage their periods was also a key indicator in evaluating how effective at least access to pads is. And maybe Rupal, you can answer the monitoring part of the question.
Hi, this is Rupal from Zana Africa in Kenya. In terms of monitoring, I think our biggest piece from an implementation perspective is the program support to ensure that the program is delivered in a quality way in all of the schools that we work in. We work both directly with schools as well as through a lot of partners who then deliver our program, who adopt our program and deliver it in the schools that they work with. And so maintaining that quality and maintaining that program support is really important for us. And that includes a component of M&E and some indicators, because that's really the key to ensuring impact and positive outcomes in the schools. I'm not sure if that fully answers your question.
I think so. Any other comments? Kathy, do you have a comment on indicators? Okay, I think maybe she's still muted. Okay, I'm going to pose another question from the chat box. One of the questions is, how do we differentiate between other illness-related reasons for missing school and menstruation-related illness?
So that question was asked, and the response is that on our questionnaire, we kept a separate response box for those who reported illness outside of menstruation. And there was also a separate option response box for those who reported menstruation.
Okay. And so similar, another question that we have from John Villasenor is, did the results, I know the NIA project hasn't presented the end-line results, but did you think that your results reached the expectations that you are hoping to find at the end of your study? So both in the case of Uganda and for in Kenya, do you think that the results that you found will help move MHM forward?
I can speak from Zana Africa's perspective, and then I can turn it over to Beth to speak from Population Council's perspective about the NIA project. So while our results have not yet been published, and so we're not able to disseminate them, we can say that specifically in terms of norms and behavior change and menstruation management and reproductive health knowledge and awareness, I would say that they actually exceeded our expectations. We were very positively surprised by the results. And at some point in the next short little while when they are public, we'd be happy to come back and tell you more. Beth, do you have any thoughts on expectations versus results?
Yeah, we have very high expectation on the results because after the dissemination, we saw even other partners who are present found there was a reason for them to pick the issue of menstruation to the next level in terms of programs, in terms of even policy development, especially at county level, because initially we did not have a standardized information, so everybody was working on what they believed or what they saw on the ground. But after the results, we are able to see specific issues coming up. Like we saw the increment of girls now having adequate knowledge to manage their menstruation, have adequate knowledge, even to make decisions regarding their own bodies and their changes and their future aspiration. So that one, we believe maybe in future years to come, we'll see this change taking place in the community. And it not only address MHM, but also will address other issues that are affecting communities, especially in Kilifi, where menstruation is an entry point, but behind menstruation, there are other issues, including GBV. All those issues have been brought up in a way that, from the study, in a way that every partner has something to pick and run with.
Thank you, Tatu. We have just hit the 9 o'clock mark, and so I want to be respectful of everyone's time. I think that the question that maybe we need another hour to discuss is how we might think about measuring the impact of MHM on school attendance or performance. So maybe we'll have to have a follow-up with more results from Meniscus and also from the NIA project about attendance and performance. I think that would be very interesting. So thank you everyone for your time, and thank you for our presenters for preparing this for us. And we will have another presentation on November 12th and then also on December 4th. So I hope to see you back then. Have a wonderful day.